Hi everyone, we apologize for the late start. This is our weekly briefing with Dr. Cara Christ on vaccine distribution. A reminder that this is an on-the-record session and we're setting everyone up to record. To ask a question after her presentation, please raise your hand in Zoom. And with that, I'll turn it over to Dr. Christ.
Good afternoon, everyone, and thank you for joining us today. For those that don't know me yet, I'm Dr. Cara Christ. I'm the director for the Arizona Department of Health Services, and I hope everyone has had a great week. We will follow the same format that we have in previous weeks. I'll give a brief presentation, and then I will leave time for questions, and I will be able to stay a little bit later due to the delay in starting, and we apologize for the technical difficulties that we've had today. So again, I'm going to go over the current COVID-19 data here in Arizona. We have continued to see a decline in the number of cases reported statewide. And so you can see that for the past 7 to 8 weeks, we have seen a significant decline in the number of cases. From a statewide perspective, we're also seeing that same continued decline in our hospital usage and our COVID-like illness metrics that we monitor, and you can find all of that on our dashboard at azhealth.gov. Again, this is our epi curve, which shows the number of cases per day by collection strategies that have been overlaid. This will be updated after this week. You'll see new mitigation strategies that are put into place. But you can see that those mitigation strategies that are in red were currently in place. And then those that are in black are key dates that have impacted specific phases of the pandemic. This is a little bit different than the data that we portray on our summary slide. This is the percent positivity of the total tests performed in Arizona. The dark gray bars are those that are tests that have been performed in unique Arizonans. We've had to date about 3.7 million unique Arizonans, so about half of all Arizonans have had a COVID test. The light gray bars are those that are done in repeat Arizonans, and you can see that over the last several weeks we've seen a continued decline in our percent positivity, with this week currently at 3.9%, indicating that our community transmission is decreasing for COVID-19. All of these are very good signs that we continue to monitor. But let's get into vaccine distribution. This week on Monday, we had a VAPAC meeting. VAPAC is our vaccine and antiviral prioritization advisory committee. This committee convenes to provide recommendations to the department to ensure a fair and equitable vaccine allocation. It's composed of state, local, and tribal experts, and those recommendations inform the local allocation process that we use here in Arizona. As we entered into VAPAC this week, we had counties that were in various phases throughout Arizona. We had some that were still in the priority phase 1B. One county that had not moved to vaccinating over 65 and above. We had a county. So that includes our 1A, which is our healthcare worker. The prioritized part of phase 1B was our education and child care workers, our protective services occupations, and adults that were 65 and older. We anticipated being in phase 2, which is when the demand meets the amount of vaccine that we have available. That's when we would transition to the general population between spring and summer of 2021. When we had the discussion with our county, or with our VAPAC meeting, you can see here, these are the phase 1A and prioritized phase 1B populations in Arizona that had been vaccinated as of February 28th. You can see that statewide, we about 60% of all phase 1A and prioritized phase 1B population had been vaccinated. And you can see that there are varying vaccination levels among our counties. Darker red means higher percentages of the population have been vaccinated. And you can see that we break that out by the percent administered with 1 dose and the percent of the population that is fully vaccinated. And so you can see that almost 28% of Arizona's Phase 1A and prioritized Phase 1B population have been vaccinated fully with the 2 doses. We use our population estimates, which use information from the Census Bureau, as well as some of our demographic information. These populations may not take into account occupation from our tribal partners, and winter visitors may or may not have been captured. It depends on where their address of residence is located. If they have an Arizona residence, they will be indicated in the county in which they reside. Then we took a look at individuals who were 65 years and older that had been vaccinated. And again, darker red means a higher percentage of those that have been vaccinated. This is broken down by county, but you can see for Arizona on a whole, we were at about 52.5% of our 65 and older population receiving at least 1 dose of vaccine, with about 19% of them fully vaccinated. And again, those same estimate issues apply here as well. We are using population estimates to determine the percent of the population that has been administered. Looking at the age group for the 55 to 64-year-olds, and this is really important as we go into the next slides, but we wanted to see how much of that population had already been vaccinated, either being part of the 1A or the 1B prioritized population based on their profession or high risk. And you can see that throughout the state, about 16.4% of individuals aged 55 to 64 have been vaccinated with at least 1 dose. And so a good percentage of that population has been started to get vaccinated, which is really important as we look at data that was presented by the Centers for Disease Control and Prevention. So we know that your risk for severe outcomes of COVID-19, including infection, hospitalization, and rate, increase with your age group. And so you can see that we knew that the 65-year and above had a significant increase in the hospitalizations and deaths, but when you look at the 55 to 64-year-olds, they are still 25 times more likely to be hospitalized and 400 times more likely to die when compared to their younger counterparts. When you look at Arizona-specific data, those Arizonans that are in our 55 and older group include a majority of those with high-risk conditions and severe COVID-19 outcomes. So 65% of our hospitalizations in Arizona have occurred in those that are 55 and above, but 90% of the deaths have been in that age group in Arizona. And so a recommendation was made to adopt a hybrid prioritization model for Arizona to cover high-risk populations and our frontline workers. Some states, as we've been watching, have moved to a truly age-based prioritization. We still wanted to make sure in Arizona here that we were covering our frontline essential workers as defined by ACIP and CDC, because we know that they have to interact with the public every day, and these are positions that are critical for the community to continue. These would be our grocery store workers, our agriculture, our food. And so we wanted to make sure that they had an opportunity to still get vaccinated while we moved through an age-based prioritization. And I'll walk you through a little bit more about what that age-based prioritization is. But as we looked at the math based on the number of doses that we are currently getting as a baseline, we broke down the remaining populations for each of those age categories to determine how much of the total Arizona population with high-risk conditions would be covered when we included that age group, and about what time we thought we would be able to progress into that next age group based on the number of vaccines that we were getting, and estimating about a 55 to 60% coverage rate. And so you can see that when we add 55 to 64, We're catching about 60% of all Arizonans who have a high-risk condition when we include that age group. When we move to above 45, you can see that we're catching 70 to 80% of those with high-risk medical conditions. And then when we move to our 35 and older, we move to about 80 to 90% of all Arizonans that have a high-risk condition that puts them at risk for severe outcomes of COVID-19. And as we move through, we anticipate it's about 3 to 4 weeks to get through those priority groups, especially as we're getting additional vaccine here to Arizona. We anticipate that in April, we'll be able to transition to our 45 and above. At the end of April, beginning of May, we should be able to transition to our 35 and above, and then in May, we should be able to transition to above 16, which is everyone who is eligible for the vaccine. So for the age-based prioritization, what we worked through with VAPAC is that the state would move to the next age group. It could move earlier if the state reached 50 to 60% of the current age group vaccinated. The age group applies to state pods, the pharmacies and the FQHCs that are participating in the CDC Federal Pharmacy Partnership Program or the Retail Partnership Program. And counties are able to move earlier if they reach 50 to 60% of their age category that's vaccinated, or if their demand slows down. So as we look at those frontline essential workers, this is a much more narrow group than our initial essential workers contained in Arizona when we were using the previous phases. Essential workers would have included everybody on Governor Ducey's executive order, as well as those that were informed by CISA and ACIP. What we wanted the counties to do was to prioritize those frontline workers as defined by ACIP that do not meet the age eligibility. That would be left to the discretion and the prioritization of our local health departments. They could sub-prioritize based on the amount of vaccine that they have by using occupational category, age, medical conditions, or certain prioritization categories that they would need. And they could tailor that to the needs of their specific counties. And so whereas Maricopa may target grocery store workers, Yuma County may target some of their agricultural workers. And there are different strategies that the counties can use to target those essential workers. They could use prioritization by the local health departments, utilizing the Janssen or the Johnson & Johnson vaccine for our younger, healthier essential workers to protect them quickly, and because we know that they have constant exposure. Doing employer-based pods, so working with some of those employers to offer on-site vaccination to their employees, and then potentially looking at private groups that are open, such as Small Business Saturday, for those small businesses that may not be part of a larger corporation that still have those frontline essential workers. So for the definition of frontline essential workers, they are defined by ACIP as a subset of essential workers, and these are the ones that are at highest risk for work-related exposure because their duties require them to be face-to-face with the public less than 6 feet or their coworkers. And so these ACIP examples include some that we've already covered, such as our first responders, correctional officers, our education and child care, but then it also includes food and agricultural services, the United States Postal Service, manufacturing, grocery store, and public transit. As you get done with what is considered frontline essential workers, there are other essential workers that can be included. These would be included in a subsequent phase if the counties were able to get through their frontline essential workers. But this includes transportation and logistics, water and wastewater, shelter and housing, finance, those types of categories. So the recommendation was made by ACIP to proceed with a hybrid prioritization, which included the age-based criteria as well as frontline essential workers. This can be found on our website at azhealth.gov. And so if you have any questions, you can look there. Steve can send it to you as well. For the week of March 7th, we expect to receive a projected total of over 2.2 million doses in total. This next week, we anticipate that actually starting as early as today, the Janssen vaccine could be in some counties. But you can see what the March 7th week, we got an additional amount of Pfizer this week, as well as an additional amount of Moderna, for a total allocation of about 323,000 doses. We are told by our federal partners that we can continue the minimum moving forward, and we should not receive less than this, except in our Janssen. We do anticipate there to be lower doses for about 2 or 3 weeks as the manufacturing catches up after that initial push out of vaccines. So we may not see quite as much Janssen for the next few weeks, but our Pfizer and Moderna should stay at this baseline. Today we hit a milestone of administering over 2 million doses of vaccine in Arizona. We have vaccinated over 1.3 million unique Arizonans, and 711,000 of them are fully protected with 2 doses. That number will start to increase as well, because Janssen is a 1-dose series. And so as they get vaccinated with that first dose, those individuals will be counted both as a unique receiving at least 1, as well as a fully protected individual. So you can see that the amount of vaccine that we are able to administer continues to grow, and we continue to make updates to the website. And we continue to add additional vaccine administration sites statewide. And so tomorrow we believe that we will hit 500,000 doses administered at our state pods. So the state pods have been responsible for about 25% of all doses administered in Arizona. But we have over 500 provider sites that have received vaccine, and over 1,500 long-term care facilities that continue to receive vaccinations. They've provided over 105,000 vaccines so far, and 100% of our skilled nursing facilities have been visited once. We expect this program to be completed in April, and continue to look towards more pharmacies getting vaccine to participate in the retail pharmacy program. And so Fry's, Albertsons, Safeway, Walgreens, and CVS are all pharmacies that are participating in that program. There are still limited amounts of doses that are going to that from our federal partners, but as they get more, they will continue to add more stores online. This week, many of you joined me for the opening of the Chandler Gilbert Community Site as a state-operated pod. That happened on Wednesday, March 3rd. This is able to do a similar capacity to State Farm, and it has a potential to go 24/7, but because of the limited vaccine supply, we're starting them with approximately 2,000 appointments per day, and the hours of operation are 7 a.m. to 5 p.m. We are very excited. The site has been transitioning well. We have partners with Blue Cross Blue Shield at that, and that was a really successful pod out in the East Valley. And we are so grateful to Dignity Health for allowing us to continue on with the pod. They in Maricopa County have provided a lot of infrastructure for us to continue serving the East Valley. And so that has been very successful. We continue with our projects on targeted communication. So we are still piloting our high-intensity targeted messaging campaign to the 85009 zip code. A couple of weeks ago, we held 2 teletown halls, one in Spanish and one in English. We will be repeating that for the 85009 zip code this week, or next week on March 9th and March 11th. And again, that includes a targeted social media effort using assets that have been translated both in English and Spanish and resonate with the community. We are also placing yard signs and community messaging such as bus stops and billboards, and we're targeting vaccine registration and transportation as a pilot in that 85009. So it's estimated that about 4,000 individuals that are over the age of 65 live in that zip code. We have been actively calling and going door to door to offer to register them for vaccination, as well as provide transportation to the Phoenix Municipal vaccine sites so that they can get vaccinated. So far, we've had about 151 individuals take us up on that. Those efforts will continue, and the vaccination events will happen next week at Phoenix Municipal Stadium. Some exciting announcements this week. Governor Ducey issued Executive Order 2021-04. This was issued on Wednesday. This required the department to update our school guidance to be consistent with the CDC's updated guidance, and requires schools to return to in-person learning by March 15th or upon return of spring break. Our school benchmarks are now aligned with CDC's transmission categories, and we will update these weekly on Thursdays using the previous week's data. So this is going to be a change from the previous benchmarks that we had been using. Previously, we had been having a 12-day lag and using data to provide some consistency, and we required a county to be in those, meet all three benchmarks for 2 weeks in a row in order to either be in the higher or lower category. There are only two benchmarks. It's case rate and percent positivity, and it will be based on the weekly data of the week just prior. So it will reflect more recent data and will be updated weekly, and it only requires it to be in that transmission category that week in order to account for that transmission category. Today, Governor Ducey issued Executive Order 2021-05. This is the next phase of COVID-19 mitigation. It removes the capacity limitation that was placed on certain establishments, but requires all other mitigation strategies to remain in effect. So that includes physical distancing of at least 6 feet, ensuring that patrons and staff are wearing masks, the enhanced infection and disinfecting and sanitation protocols, and it also allows spring training and major league sports to operate with an approved plan for mitigation strategies by the Department of Health Services to be in place and followed. And with that, I will take any questions.
Okay, first up is, per usual, Cameron Pullum.
Hi, Cameron.
Hi, Dr. Chris. Obviously, today, my questions are going to be related to the new executive order with the mitigation strategies in place. The big question, especially for those who have yet to receive any vaccine or haven't gotten their second doses yet, we only have 700,000 people fully vaccinated yet. Give me an idea of what led you to believe that this is the right time to relax these mitigation strategies that have been proven to reduce the spread in our community, especially considering potentially even more spreadable variants that scientists around the world are worried about. That's my first question.
Yeah, thanks, Cameron. That's a great question. And so as we look at our data, we've seen that our data has been trending in the right direction for quite a number of weeks now. When you look at our total percent positivity, we are below 5%, which for percent positivity puts you in the minimal category, as well as our COVID-like illness metric has gone down significantly. We are keeping all mitigation strategies in place except the occupancy requirement. And so that had restaurants at 50%, that had movie theaters at 50%, it had gyms at, I believe, 25%. And what we've identified is as long as people are maintaining that 6 feet of distance and staying distanced and wearing masks at all times except when actively eating or drinking, we felt with the current community transmission that we could reduce those, just the occupation or the occupancy requirements that had been put into place. Restaurants have gotten very good about making sure that people are physically distanced and requiring the mask use. So we wanted to be able to lift that portion of the strategy.
I have to tell you, a lot of people on social media are already celebrating this as like the end of COVID, and they're saying now remove the mask mandates. That population is taking this as, this is over, do what you want.
That brings up a really good point, and we are not out of the woods yet. I mean, we are seeing positive trends. We are increasing our vaccine administration, but we still need Arizonans to take those same precautions, which are remaining 6 feet away from people you do not live with, wearing a mask whenever you are with people you do not live with, and then making sure that you're washing your hands and that you're staying home when you're sick. But what we saw when we saw this most recent spike back in December and January, it wasn't necessarily the establishments or the occupancy limits that had an impact. It was those people gathering in those small private settings where people were letting the masking and the physical distancing down. And so it's a great reminder that we can't let that down. But being able to lift this for our businesses as we are seeing improved metrics is a key step forward.
My last question is regarding the sports venues. So obviously that's a big question. What will that mean as far as capacity with sports venues? Some of these are 50,000 seat arenas. So does that mean, if you're doing social distancing, what capacity does that truly mean?
So we've been working very closely with our sports teams, and I can give you an example. We've been working very closely with the Diamondbacks on their mitigation strategy and plan. And so, when you look at their mitigation strategy, so they are going to require and enforce the use of masks. They are going to do seating pods that seat groups, small groups together with a minimum of 6 feet in between groups. And you will see a much reduced capacity. I think that 6-foot pod seating puts them at about 25% capacity. And so in addition, you'll see traffic flow. They've added touchless interactions between their staff and patrons. And so you'll see a different environment at those, but we'll be able to bring people back to Major League Baseball.
Thank you.
You're welcome.
Next up is Josh Sanders.
Hi, Josh.
Hey, Dr. Chris. Couple questions for you. First one, not executive order related.
Okay.
So, 76% of Arizonans are not vaccinated at state-run sites. Should the state allocate more vaccine to the counties?
So, and that is actually our plan. And so, right now what we're doing is we're keeping the Pfizer vaccine, which has those really stringent storage requirements, at the mass vaccination sites. Some of those are state run, but some of those are county run. So while it looks like a lot of the Pfizer is staying with the state, that's because we're directly allocating to those county and state pods. All of the Janssen vaccine was allocated to the counties. We expect that they will be able to use that in their communities, and that's kind of our plan moving forward. And almost all of the Moderna goes to the counties as well. And so we will continue as we get increased doses to give more and more to the community, because what we want to see, while we like the state pods and the mass vaccination efforts that we've got there, we do want to see more community-based efforts. And so trying to get increased vaccine to our local partners is exactly what we want to do.
Next question is two parts, and it is in regards to the executive order today.
Okay.
Do you agree with Governor Ducey's executive order today?
So I agree that keeping the mask mandates and the physical distancing in place is an extremely effective way to slow the transmission of COVID-19, and reducing the occupancy, which was, we were trying to reduce the occupancy to make sure that physical distancing was established. What we've found is that there are instances where you can be 6 feet apart, but maybe be able to get a little bit more capacity in there. And so, yes, we are in agreement with the executive order.
5 million Arizonans have yet to be vaccinated, so why do you think this is the time to lift those capacity limits?
Yeah, so all of the other mitigation strategies remain in place, which are, proven to slow the transmission. So mask use, the physical distancing, the increased hand washing. We will continue to accelerate our vaccine administration efforts. And so as we've got reduced transmission in the community, we wanted to make sure that we were taking appropriate steps forward. Now, this is not a return to normal. It's just going to take the capacity limits off of those establishments.
Last question. I spoke to a small business owner, restaurant owner in downtown Phoenix who says this is just purely political. There's no way for their restaurant to operate at full capacity and still have those 6 feet in between, their people. Will Hummel says the four mitigation requirements were just on paper as well, and that you and the governor are just finally acknowledging through this executive order. I realize this isn't your executive order, but that the governor is acknowledging that the mitigation efforts or requirements when it comes to reduced capacity weren't really being enforced to begin with. What would you say to that?
I would say that there's probably some business owners out there that got shut down that disagree. And so we do go out. We still are going to have enforcement authority as well as our local jurisdictions to enforce the mask use, the physical distancing, all of those strategies that are required with those establishments. And so, we are going to maintain that compliance program. And that was exactly what you were saying from the small business. It depends on the location, it depends on the seating arrangements, but even at moving to requiring the 6 feet apart, we're still not going to be at full capacity.
Thanks for your work, Dr. Christ. Appreciate it.
Thank you.
Next is Peter Seymour.
Hi, Peter. Sorry, this is a weird mask.
Hello, Dr. Christ. Good afternoon. So I wanted to ask a little bit more on the enforcements. Who's going to do the enforcements, and who was perhaps measuring the restaurants and these other establishments that, yes, you can be full capacity, and yes, there's still 6 feet available? I mean, was there a tape measure involved? I know it's a little tongue-in-cheek the way I'm asking this, but how was this all calculated?
Yeah, so we will still continue to do the enforcement, as well as any local jurisdictions or cities that were also participating in enforcement or want to moving forward. And it depends on the establishment. So there are different ways that they can do that. They could move them 6 feet apart. If we got a complaint that they weren't, our surveyors would go out and potentially, could measure between tables. But if they went and they were seating every other table and every other table had been marked off, then visually that they would know that it was greater than 6 feet. So it's going to depend on the establishment and how they're implementing those protocols. There are certain requirements within movie theaters that will still be in effect to maintain that 6 feet of distance, but that is something that the surveyors would look for if that was the complaint.
And also, did you talk about the governor with this executive order before he issued it a couple of hours ago? What kind of input did you give to this?
So I work very closely with the governor's team on these mitigation strategies, and really felt that the mitigation strategies that we had outlined in our documents for each of those individual establishments could be maintained without the capacity limits. And so as long as we are requiring the 6 feet of physical distancing and the mask wearing and those other things that we've put in there, we felt comfortable. And so, I was working very closely with the governor's office on that.
Was it your suggestion that we could go ahead with this executive order and all the contents therein?
Yes. So in reducing the capacity and maintaining all of those mitigation strategies, that was our recommendation.
And lastly, are you concerned with spring break coming up? I know I asked you this last week, but now that we have this new executive order, with no capacity limits, with vacationers, more people moving around, spring break, a lot of people off, of course. What does this mean for another surge potentially?
So, anytime people get together, there's a risk for transmission of COVID-19. And so, as long as the establishments are requiring the mask wearing and the physical distancing, that should reduce the risk. And we encourage all Arizonans to make sure that they're taking their own precautions. So if you're at a restaurant trying to eat outside, not removing your mask unless you're actively eating, not sharing some of those, like nuts or out of the same container, like sharing chip and dips and stuff. And so really taking that and not going out if you're sick or if you've been exposed to someone with COVID-19. Spring break, a lot of people will travel, and so that always poses a risk when you're traveling to other areas that may have higher transmission than Arizona, and then bringing it back. So we would just caution everybody, make sure that you're taking those simple precautions. But we didn't see a spike after Super Bowl, which was really great because we knew, that's usually a time people get together in those small household settings, and we've continued to see a decline, so that's promising.
Very well. Thank you, Dr. Christ.
Thanks, Peter.
Next is a staff member at Capital Media Services.
Hi, Howie.
The entire staff of Capital Media Services. Hi. So no nachos for you and me sharing them?
No, not right now. No.
Okay.
Okay.
Just a couple of questions. I saw the list in the executive order, which includes bars that do dine-in service. But the original order also covered bars that are just bars. What changes for bars, or are they still closed?
So the mitigation strategies are still in place. So they are still paused until we meet the criteria for them to potentially open. So bars that are serving, providing dine-in services are able to open.
So basically, bars that you have the bar stools, you have dancing, all that stuff, we still can't go there.
So yeah, so at this time, we still can't go there. As we continue to review the data, we'll see if that's one of those mitigations, strategies that will be able to eventually open, but they were closed until they were at 3% or below 3% positivity.
Okay. Also, there's some legislation making its way through, got out of the House, in fact, to say that businesses can ignore mask mandates. Do you care to say what you think of such a law that would allow business to tell you what you could do with your mask mandate?
I'm sure you're tired of our phrase, but we don't comment on pending legislation.
But it's inherent to what your own orders are. I mean, essentially, this would undermine exactly what you're saying. No?
Well, and we hope that everyone takes our guidance and wears a mask whenever they are around people that they don't live with. But I can't comment right now on pending legislation.
Oh, come on. Okay, one more. I'll give it a shot. And this sort of follows up on what one of my colleagues asked. The fact is, if you are going to require 6 feet between tables, if you're going to require 6 feet between groups of customers in movie theaters and sporting events, it's nice to say, well, we're getting rid of the occupancy limits, but they effectively remain. Isn't this just window dressing?
So it will allow them to increase above that 25 or 50%, and so it will provide them with some additional relief, but the physical distancing is a very important component of the mitigation strategies. And so it doesn't probably allow 100 to 110% of the capacity, but it will increase them a bit above their current ability.
Okay, I give up. Someday you're going to talk to me about what's in the legislature. Thank you, guys.
Okay, next is Alexis Burdine.
Hi, Alexis.
Hi. My question is, the U of A state-ran pod extended its hours. We've had some viewers who've just been a little confused. They want to know if longer hours directly translate to more vaccines, more appointment slots, and in that same premise, will increase and decrease rather as the vaccine supply does?
Yeah, that's a really great question. So yes, when we extend hours, that means more available appointments. And as we're getting a little bit more Pfizer vaccine, we're able to allocate more to the pods so that they can provide more appointments. So we're hoping that we won't actually have to reduce appointments moving forward. What we're trying to do is open up smaller banks of appointments so that we can be more responsive to those increases in vaccine. So we're hoping not to have to reduce it because we're told that this is our new minimum baseline, but that is the anticipation, is being able to respond to how much vaccine is in the community.
Thank you.
Okay, next is Juan Juarez.
Hi, Juan.
Hi there, good afternoon, doctor. Thank you for having this conference. So yeah, I just want to follow back on those businesses that now are going to reopen. I mean, a lot of us, we are in and around the community, so we've seen a lot of businesses that weren't really, following the rules 100%. We saw, the different places that had maybe more than the capacity that was done. So are you concerned at all about a spike in cases? I mean, a lot of the population, the general population, especially the young population, that does go out more, than the other people, are possibly going to be in crowded environments even more now than ever, and then coming back maybe with their families and potentially causing more spread. So is it the right time really for this? I mean, are you jeopardizing perhaps all the progress that was made after the holiday break?
Yeah, so we have made a lot of progress since the holiday break. And I think, with the physical distancing and the mask requirements, those are really important strategies for slowing the spread of COVID-19. We do go out and do enforcement, and this will be something that we continue to monitor. And so we would recommend, if people see establishment that's not complying with that, to report that to us so that we can go take a look. I think right now, as you look, if we keep those mitigation strategies in place, we can remove the occupancy. That's one step closer to getting us back to normal, although we're not there yet. And so we'll continue to monitor and make recommendations as we see, what each step does to our data.
And if the cases do happen to go up, weeks after businesses start doing that, would you guys go back and say, you know what, this was probably not the right decision? I mean, would you expect to? We haven't really seen any new measures since the summer. We had that huge spike, then the slow came afterwards, and then we saw a huge spike again in the fall and the winter. But then there wasn't really anything done besides what was reduced during that time. So if we do see a spike again after this decision, are you going to do anything about it with regards to more limitations? I know we have the vaccine, but can there be more done?
As you look at what other states are doing, so there are states that have done the entire gamut, and we know that masks and physical distancing and those strategies work. But even those that had put a ban on even outdoor dining, they still saw the same spike that we did. So it's really those personal behaviors and making sure that you're not letting your guard down with your mask and not getting too close to people that you don't live with. And so we'll continue to monitor. I don't know that we would replace the capacity issues back on if we started to see a spike, because I think the other thing that we have going on at the same time is we will continue to see an accelerated administration of vaccine. And hopefully by summer, as long as there's not any manufacturing or federal transport issues, we hope to have enough vaccine in the community for everyone who wants one. And so that's going to play a huge role in our mitigation as well.
Okay, thank you.
You're welcome. Thank you.
Next, we have Bud Foster.
Hi, Bud.
Hello there, are you there?
Yeah, I can hear you. Yes.
Okay, great. I'm very happy about that. And thank you very much for doing this. We really do appreciate it. The Pima County sent you a letter on Wednesday asking you about the testing funding. Pima County is going to end their free testing on March 16th if they don't get funding. You approved $14 million a couple of weeks ago. They have yet to see a penny of that. They haven't seen any money from you. So they're still using general fund money, and that will play a large part in their decision. Obviously, they don't want to do that, but they would like to know why you are withholding the funds.
Yeah, so it's probably just a contractual issue. I would need to go in and see what was holding that up, because they should have the $14 million, but I'll check with the team and I'll have Steve follow back up with you, Bud. And then we are looking at finalizing the overall budget and looking to give the counties more funding on top of what they should have already gotten. So we'll look into that for you.
Pima County says that it has vaccinated a lot more people than any other county, and they use the expensive PCR tests because they felt like it was the right thing to do, and they feel like they're being penalized for making that decision. Are they being penalized for making that decision and kind of forcing them into a corner where they have to think about maybe ending the free testing, which would set back, obviously, many of the gains they've already made?
No, I hopefully they don't feel penalized. We are not penalizing them for making that decision. They have done a fantastic job with the testing. And so we enjoy working with our partners at the Pima County Health Department. We just don't have the ability to go back and reimburse, but we are looking for ways to continue the testing opportunities that Pima County has built, because we do think that they've been successful. But just like Pima County does, we have limited amounts of resources, and we're trying to allocate it fairly to all 15 counties. And so we take that into account, but we think they've done a fantastic job.
They say that this money was allocated for this particular purpose for testing, but yet it's not being allocated at this point. They feel that they are being singled out. They don't feel like they're being singled out because it hasn't been sent to any county yet. Why hasn't it been sent to any county at this point?
Yeah, so that would depend on where it was held up. There's several steps in the contract process, and so we'll look into that for you, but our goal is to get the money out to the counties as quickly as possible. And so just like you said, if it's happening to Pima, it's probably happening to other counties, so we'll take a look at that and see where it is.
All right, thank you very much.
You're welcome.
Stephanie Innes.
Hi, Stephanie.
Hi, Dr. Christ. Thanks for taking our questions today. I just wanted to ask you about the state's new rollout plan. When are people in prisons going to get vaccinated? Is that something that the state is doing, or how is that being handled?
Yeah, so we're working with the Department of Corrections right now on their plan, and so they will be implementing the age-based rollout as well, and that should start relatively soon.
Oh, that's great. And then just one follow-up question to the age-based rollout. So does that mean the state is not doing any frontline vaccines anymore? So that's solely up to the counties? Is that right?
So we will do, based on the way the pods are structured, it's very easy for us to verify age and those types of things. So we felt for the mass vaccination pods, focusing on the age base would allow for that efficiency. The counties are able to do some of those local based. So like if you figure, Fry's Food has a large number of grocery store workers, but they also have a pharmacy and can receive vaccine. So Maricopa County and Pima County or other counties may work with Fry's to get them allocated vaccines so that they can vaccinate their employees. It would be strategies like that the counties really are the best experts. Increase vaccine. So if we start to drop off, we know that we'll also pick up some of those essential workers as we move into the next age category. And so this was one of the fastest ways to get the people with those chronic medical conditions, but also those at highest risk, vaccinated.
Okay, great, got it. And then the last thing is, did you look at any other states as models for this hybrid, or was it a recommendation from ACIP, or how did you come up with this? Was it just the committee, or what? So
it was a number of things, and it's hard to point, I think, as I look back. So, we had heard of other states doing this. Connecticut is one of the ones that comes to mind as we were looking around. But it also kind of came up organically through conversations at VAPAC. Based on the risk and the data that we had been seeing. So we put that information together for them. And so it was a combination pretty much of all of what you described.
Great, thanks so much.
You're welcome.
Next is Monica Garcia.
Hi, Monica.
Hi, can you hear me?
Yeah, I can hear you.
So our station has just been bombarded by people with health conditions ranging from cancer, HIV, Down syndrome, you name it. A lot of them are in their late 30s. And I want to confirm, do they now have to wait until their age criteria is met before they can get the vaccine? If so, what do you tell them? A lot of it's going to be like towards the end of April, some folks in May.
Yeah, so that's a really great question, and it's the same question we're getting a lot. So there are very specific conditions, and not all of the conditions you named places somebody at higher risk for COVID-19. And all of these, I can guarantee you, have been very difficult and stressful decisions that VAPAC has had to make in making recommendations to the department. This will actually, based on the timeline, get those higher risk people with some of those conditions vaccinated faster, because they won't have to wait until the entire list of essential workers, which was extensive in Arizona under our previous phases, to be vaccinated, because those with medical conditions weren't until 1C, which Maricopa County, Pima County, we had not even moved into the essential workers. And so this will prioritize those while still, with that hybrid situation, being able to vaccinate those essential frontline workers that have to come into contact.
Perfect, thank you.
You're welcome.
Okay, next is Cody Lee.
Hi.
Hello, Dr. Christ. I'm Cody Lee with CBS 13 in Yuma. I have a couple questions real quickly. I know you mentioned that the Janssen J&J vaccine will go to counties and rural areas around the state, but as far as Yuma County specifically, what can you tell us?
So I don't know that I have specifics on Yuma County using their Janssen for a specific population. I do know their local health officer, Diana Gomez, is on our VAPAC committee and was very excited about the recommendation of the Johnson & Johnson vaccine coming online, because it does provide additional opportunities. It doesn't have the storage requirements. It's one shot, utilizing that in our frontline agricultural workers that may move around is going to be highly beneficial.
Right, yeah, that's exactly why I was asking about it. Definitely can be stored in less cool temperatures. So, and another question I have, my last question, is Yuma County, obviously along the southern border. So are migrants crossing the border able to be vaccinated? And will that affect residents who want to be vaccinated who live in Yuma County?
So we don't require residency for vaccination in Arizona. Arizona is unique in the fact that we have, a high number of winter visitors in the winter from other parts of the country. We are a border state, so we know we have day workers that go back and forth. Plus, we have a huge agricultural community here in Arizona because of our weather, and we do get those migrant agricultural workers that come in for the season. And so we recommend that anybody who is eligible for vaccination to get vaccinated. All that does is it provides more protection in our community, because these people are going to be coming in and out of our community and are just at risk for bringing COVID-19 in or acquiring COVID-19 once they're in our communities, spreading it to others, or potentially needing a hospital bed. And so anybody who's in Arizona and meets the criteria for getting vaccinated would be eligible. And we would hope that that opportunity would be afforded to Arizonans in other places as well.
All right, thank you so much, Dr. Christ.
You're welcome.
Our last question is from Rocio Hernandez.
Rocio?
Hey, good afternoon, Dr. Cara Christ. Can you hear me?
I can.
Okay, good. You just never know these days. I had a couple questions on the Johnson & Johnson vaccine and the executive order. On the Johnson vaccine, what amount, are all counties going to get the same amount? Like, is it going to be divided between them equally, or what percentage do you expect each county is going to get of the Johnson & Johnson?
So the counties will get an allocation of the Johnson & Johnson based on their population of the state's eligible population. So it's broken down using a formula, but each of the counties should get a pro rata allocation of the Johnson & Johnson.
Okay, thanks. And on the executive order, I'm trying to understand what this means for sporting events. I'm not a huge sports fan, so hence my question, and neither were some of my editors. We were trying to understand because isn't the Cactus League and other pro sporting events, those have been happening even before this executive order. So what exactly does this change for spring training and other major league sports? And, you know, with the occupancy limit, does this mean that now the stadiums can be filled, or who's going to set how many fans can be at the stadium or bleachers?
Yeah, so that's a really great question. And as you look at the Cactus League had, based on the previous executive order where they had to get approval from the jurisdiction that they were operating in, they had to provide a mitigation plan that had to be posted online. So the Cactus League had gotten together with all of the cities and all of the stadiums in order to get approval to operate. That approval does not expire with this new executive order. We had previously reviewed their plan and had approved it after they had submitted it to us. So what that will do is that will allow them to continue operating. For things like the Diamondbacks, that will allow them to utilize their plan. All of those plans indicate that they will maintain groups more than 6 feet apart, whether that's tying, like using zip ties to keep the seats up so people can't move seats, and they're restricted to their seating pod. It does require masking. And so that depends on each of the specific venues on how they're going to do it. You know, venues that have an open grassy field are going to be different than the stadium style seating. And so they've developed plans for both of those different types of seatings that do require the 6 feet of physical distancing. And so you will see much smaller crowds than we have seen in the past for those types of activities.
Okay, everyone, thanks for joining us today. Thank you, Dr. Christ, and
Thank
have a
you.
great day and weekend.